Hi everybody, I'm Dr. Udine and welcome to Dr. Harry's Healthy Corner. Today I wanted to talk to you a little bit about hair. Did you know that 40% of hair sufferers are women in America? That's an astonishing number, and I know that we tend to feel that perhaps we're the only one that are suffering with any hair issues, and so you know that is not the truth. And believe it or not, 80% of women with hair issues feel that it impacts their self-esteem, and that is pretty significant. I want to tell you a little story. About a few years ago in 2015, I started noticing a significant amount of hair loss. And I have noticed that before after giving birth to both of my children, so initially I really didn't think anything much of it. But one day it seemed like out of the clear blue sky I discovered two large patches of large hair loss in the back of my head. And that to me was astonishing. It seems at that time I was developing alopecia areata. And that is a form of hair loss where the immune system tends to attack the hair follicles. And so I want to say to you that I understand fully what's happening with you if you are experiencing any of these things. And I wanted to be able to explain to you a little bit about what causes hair loss. And in the second part of this series, I wanted to talk to you a little bit about what we can do about hair loss and how to diagnose hair loss. I wanted to keep this relatively short at about 5 minutes because I know most of us, we've got things to do and places to go and people to see. So let's jump right into it. So what are some causes of hair loss? So there's several causes of hair loss, and I'm sure many of you have heard of some of those causes, but I'm just going to talk about a few of them. One cause of hair loss is something called telogen effluvium, and that basically, to fully understand what that means, I need to talk to you a little bit about the stages of hair growth. So there are three stages of hair growth, right? So one is called androgen, and that's basically the phase where the hair is growing. So that can last, depending on the individual, anywhere from 2 years to 7 years. And that's where we acquire length and the hair is in the active phase of growing. Then we get to the catagen phase, and that is a transitional phase, usually lasting for about 2 to 4 weeks. And then we get to what's called the telogen phase. And that is the phase when the hair goes into the resting phase and the hair begins to fall out and then recycle. So the good news is normally there are only 10% of the hair that is within that cycle. And that's what tends to give us about an average, about a loss of about 100 hairs a day, and perhaps slightly more, 200 or so, when we wash and condition our hair. So when we understand the three phases of growth that we talked about, androgen, catagen, and telogen, we can start understanding the things that impact any one of those phases can cause us to lose our hair prematurely. So when I said a little bit ago that the one form of hair loss was called telogen effluvium, and that is primarily a hair loss that follows a significant change or stress or something that the body considers traumatic. And so falling into this particular type of hair loss, significant illnesses, hospitalization, surgery, childbirth, after childbirth, you can experience that. And basically what happens here is that the hairs start entering into the telogen phase very early, like earlier than they should. And so then we have more hair within that phase, that resting phase, and so we start losing more hair. So perhaps instead of having 10% of hair within the resting phase, we now have maybe 20% or 30% or so. The good news about this form of hair loss is once we address the cause of it, it's usually very reversible. So things that also can cause this to happen: yo-yo dieting, crash dieting, malnutrition, nutrient deficiencies. These are all things that can cause our hair to prematurely enter into that resting phase. So that's one form of hair loss. And again, easily reversible. Usually, unfortunately, for some women, this turns out to be a chronic condition. But for the majority of women, this is usually very reversible. The other form of hair loss is perhaps the most common form, is called the androgen alopecia, and that is the form of hair loss that we refer to as male pattern baldness or female pattern baldness. And this is the one that has a genetic component, or can be significant, or can be caused by a hormonal imbalance of the androgen hormones. And the androgen hormones, of course, are testosterone. And it's not testosterone itself, per our understanding currently, it's not testosterone itself that can trigger this form of hair loss, but it's the fact that testosterone converts over to something that's significantly stronger than testosterone, and that tends to interact with the hair follicles, and it causes the hair follicles to die prematurely, and also may cause the hair to start thinning. Now, many women start experiencing that form of hair loss usually around menopause as well. So sometimes it's difficult to assess if your hair loss is from the telogen effluvium, or if it's from the androgenic form of hair loss. And visiting your physician, you might be able to determine that. So some things that keep in mind with the telogen effluvium: the hair loss that follows that sudden illness or sudden stress can usually be delayed by up to 2 months. So sometimes it takes some thinking about what that stressor may have been. Of course, if you, after childbirth, yes, this stressor is usually noticeable at that point. If you had a surgery, a significant surgery that the body has determined is traumatic, usually about 2 months or so after that surgery, you can start experiencing that form of hair loss. The androgen form of hair loss is usually, again, escalates usually around menopause, and that's when we start experiencing some of that hormonal type hair loss. And that's a different form of hair loss. It's important to know the forms because the treatment also depends on that. Another form of hair loss is called scarring alopecia, and basically it's anything that causes the scalp to scar and can cause you to lose your hair. And unfortunately, once the scalp starts scarring, the hair loss is usually irreversible at that point, because it's difficult for the hair follicles to regenerate through scarring. Then the form of alopecia that I had is called alopecia areata, and that's an autoimmune form of alopecia. And for those of you, yes, there are pictures out there. For those of you who have my book, I shared those pictures because, again, I feel we as women, we need to be able to share these things. We need to be able to say you're not alone. We need to be able to say this does not determine who you are, and we need to be able to stand together. Okay, so that form is called alopecia areata, and alopecia areata is an autoimmune condition, and basically is where the immune cells attack the hair follicles. And this happens during the growth phase. So when it attacks the hair follicle during the growth phase, then the hair follicles start falling out. And it usually happens in a pattern where it's usually round, very smooth. The edges, again, tend to appear relatively very smooth, and it can be patchy as well. I had several patches occurring at the same time. So the patches can and it's almost, I don't know if you've ever heard of the terminology, a mangy dog, but basically what that dog is suffering from is usually alopecia areata. And that's an autoimmune condition that's usually treated completely differently, because there's usually some inflammation going on in the follicles secondary to the immune cells attacking that. Some other forms of hair loss, of course, when we do, as women, it's possible to do excessive processing of the hair, excessive use of styling of heat and styling tools can also lead to hair loss. Once those things are removed, hair usually regrows relatively quickly with that. So nutrient deficiencies will fall under the telogen effluvium, because what happens is that when the nutrient is deficient, it kind of pushes the hair out of the growth phase into the resting phase, and the hair starts falling out. One form of hair loss is actually it's a psychological condition where the individual just persistently pull at the hair, and it's not really a conscious thought of, gee, I'm pulling at my hair or anything like that. It's usually an unconscious coping mechanism. So infections can also cause that. So ringworm, which is a fungal infection of the scalp, can also cause hair loss in round spots. When that's treated, again, hair usually grows back pretty quickly after that's treated appropriately. And then traction alopecia simply means when we're pulling the hair too tightly. That tends to occur around the hairline, because most of the time the traction is usually around the hairline, and the hair is usually pulled out at that point. So those are some common causes of hair loss. Like I said, I don't want to overwhelm you with a lot of information initially. I wanted to initially talk about some causes, and I want to initially just really talk about the phases of growth in the hair, so we start understanding perhaps where this could where the interference can occur, and where hair loss, the cause of hair loss. So another form of hair loss, of course, is during chemotherapy, when the medication, of course, which is killing fast-growing cells, the hair is usually impacted here as well, and that form of hair loss is usually more immediate, and it's called androgen effluvium, but that's usually when the hair loss is usually more immediate. Certain types of medication can trigger hair loss as well. Now, the hair loss can be immediate, but it's usually delayed and falls more under the telogen form of hair loss. So those are some forms of hair loss. And next time, what we wanted to talk about is kind of review this material, but also talk about some ways to start treating those forms. First, we want to diagnose them, and we'll talk about some patterns. So we talk about the telogen effluvium, which is usually more of a diffuse type of hair loss. You can perhaps diagnose this if you go to your doctor. They will start to do a little bit of a pull test, see how many hairs fall out, what the hair at the end looks like, and that usually is able to give them an indication of if that's the type of hair loss that you have. Just by looking at it, many times you can determine if it's alopecia versus a ringworm situation. And of course, if there's an inflammatory condition, then there's usually pustules around the hair follicle. So that one is usually able to be identified again. Androgen alopecia, or male or female pattern baldness, looks a little bit differently in men than in women. In men, it tends to be more of a receding hairline. In women, it's usually the part starts widening, and then it starts thinning. The hair starts thinning from the crown, and so initially what you see is a wider part, and then it starts thinning, and you're able to almost see through the hair as the condition progresses. During menopause, if that is the cause of it, then of course your doctor will talk to you about things like hormonal therapy. So I'm jumping ahead, but hopefully this gave you a little bit of information about hair loss, and I'm sorry we started a little bit late, but technical difficulties as usual. So we'll see you next time, where we'll talk about treatments that ranges from topical to injections. But I'll tell you also what I did and the results that I have, and how my hair is currently doing now. And if you have any questions that you would like me to answer at that time, please feel free to send them to me. So until next time, bye-bye. Oh, hi, Nadine and Adrian. Glad that you guys could join, and I will see you next time. Bye-bye.